Hello, everyone. We're going to get started in just a couple of minutes. In the meantime, we'd like for you to find and check out our Q&A box. That's how you're going to be able to ask questions and engage with us. It should be on the upper right-hand side of your screen or maybe down below, and it looks like a couple of small flags with a question mark. So again, take a minute or so to check that out, and we'll get going shortly. Thank you. Good evening, and thanks for joining us for the UVM Health Network HealthSource presentation, Telehealth and What It Means for You. I'm Christine Buck, and I'm the Community Health Resource Center Program Coordinator at UVM Medical Center, and I also manage the HealthSource Classes program. It's been a historic and challenging year due to the COVID-19 pandemic, and our new ways of working and meeting have changed our class programming. This is why we're now offering our free community health education online, and we hope that you'll enjoy our new virtual format. By offering virtual classes, we can now welcome participants from all throughout the entire UVM Health Network region of Vermont and Northern New York. Before we get started, I just wanted to review a few important housekeeping items. This session is going to be recorded and all attendees are muted. Again, if you'd like to engage with us, please use the question and answer box. Again, this should be either on the right-hand side, the top right-hand side of your screen, or maybe down below in the middle, and it looks like a couple of little flags with a question mark. We will try to answer as many questions as we can during and toward the end of the presentation. And also in a couple of days, keep your eyes out for an email. We will be sending you the class slides, a survey, and also a link to the live recording. We hope you will take a few minutes to complete the survey, as your feedback helps us to improve and strengthen our future programming. So tonight we're joined by Sarah Kessler. Sarah is a senior telehealth program strategist at UVM Medical Center. So I'd now like to welcome Sarah.
Hi, thank you. Thank you everyone for joining this evening. Tonight we're going to talk about digital health, also known as telehealth, and what we're doing here at UVM Health Network. To start off, we'll review who we are. So the University of Vermont Health Network is comprised of 6 hospitals in the state of Vermont and Northern New York. This map over here shows where we're located through our region. So you can see the 4 dots in Vermont, and then you can see the 3 over in New York. We serve about 1 million patients, and I should also mention that we have a home health and hospice system also incorporated into our umbrella. Who I am. Again, my name is Sarah Kessler. I'm a telehealth program strategist for the Health Network. I've been in that role for almost 3 years. I've spent the majority of my career at University of Vermont Medical Center in various roles. This is a picture of my daughters and my puppy and me. I have 2 daughters, 12 and 10, and a crazy 5-month-old puppy. We live in the area. I grew up in the area. And my connection to UVM Medical Center really runs deep. I go way back before I was even born. My mom was a nurse in the ICU in the emergency department at UVM or Fletcher Allen in the 70s. My parents met in the ED in the late 70s. My dad was an EMT. My mom was an ED nurse. They met and got married. They had my brother here at the hospital in 1981. They moved out of state for 2 years, had me, moved back. My mom went back to the hospital and was an ED nurse for years throughout the 80s. She received cancer care here at the hospital. Really wonderful care teams took care of her. She ultimately passed away here in 2001. And then my 2 daughters were born here in 2008 and 2010. So it's truly an honor for me to be able to be a part of this UVM Health Network family and be able to carry out the mission every single day. So to get into the content for tonight, we're going to watch a short video. So bear with us one moment. Here we go.
The University of Vermont Health Network has expanded video conference visits to connect patients with their healthcare providers. Here's how it works. First, talk with your provider to see if a video visit is right for you. If so, you'll be scheduled. You'll also be contacted by our support team to help you prepare.
Hello, my name is Lauren. I'm calling to prepare you for your upcoming video visit with your provider.
Download the Zoom Cloud Meetings app on your iPhone or Android. If you need another option, our support team can help you. You'll receive a follow-up email with your confirmed appointment time and a link to the video conference. Just click the link at the time of your appointment. For more information about video visits, talk to your provider. The University
So back to it. How many of you, I'm so curious, how many of you are using FaceTime or Zoom socially? So with family, with friends? So it looks like some of you are. That's really great. My next question is, how many of you have connected with your provider or care team or some type of group, health session group, using Zoom or some other video platform? Okay, also a couple. Okay, great. And my last question for you tonight is, or maybe, is how many of you have a MyChart account? Okay, a couple. That's really awesome too. Thank you for answering and playing along. Here's what digital health can look like. We've all seen the icon for Zoom up in the middle. There's some MyChart icons. There's this is over to the right. It's what an e-visit looks like when you've logged into MyChart. So, and then at the bottom here, we have a camera that's placed or lives in a primary care office, and we take digital images of the retina and can send them to an ophthalmologist in Burlington to read them. So digital health, and I'm hoping some of you have seen or experienced some of these, really can take the shape or form of different things. When we have programs, which we have several, many digital health programs, particularly video visits, we love to hear from our patients. We love to hear from our families and know how things are going and how we can make things better. This slide shows some of the survey feedback. So we've done a lot of surveying this year. especially because our volumes have increased so much, and more of our providers are offering digital health services to their patients and families. I love these. We're hearing very thorough and pleasant conversation with my PCP. Fantastic experience. Someone said, I thought the video visit was great. I mean, you can read through these, but this really resonates with us, and it makes us want to do better and more, and we love this. So what are we doing? Again, digital health can take different shapes and forms. Digital health can be an encounter between a provider and a patient. It can be provider to provider. It just depends on what the need is, what the indication is, and time frame and things like that. So I have a table here and I'll take you through. The first thing is MyChart. MyChart is our patient portal. We use Epic as our electronic medical record, and MyChart is the patient portion of that. So patients can have an account created, they can log in and do many things. They can update their insurance information, they can upload an image of their insurance card, they can pay a copay, they can pay a bill, you can schedule appointments, you can message your healthcare provider office. And another thing is that we do have e-visits, which is below here and I'll get to, but an e-visit is also available through MyChart, and it's a really great service. So we love when patients engage through MyChart, and we encourage you to ask your provider's office about it or go online and check it out and activate an account. Next thing that we're doing are video visits, and I think video visits are the most commonly known form of telehealth. That's a live video audio encounter between you and your provider or you and your care team. Throughout the health network, we use Zoom. We send an invitation through email where you would receive a link in your inbox, and at the time of the appointment, you would click the link. Your provider and care team also joins that meeting. It's secure, and you connect, and you can have that face-to-face encounter. The majority of our ambulatory clinics are doing video visits right now. The next is e-visit. So I referenced that very briefly before. An e-visit is an encounter between a patient and a provider. It's not considered live. It's considered store and forward, which is something that you would complete and then forward on, pass along to your provider. The e-visits that we have are symptoms-based questionnaires. You would log into MyChart and select e-visit. Select what what's going on. So symptom-based, it could be cold and sinus, it could be UTI, and you go through the questions. And once you complete it, it then sends the questionnaire through Epic into the inbox of your provider at your PCP office. He or she will review, triage, and respond to you. We've gotten really great feedback on that, and the majority of our sites within the medical center for primary care are live with e-visits currently, with expansion throughout the network on the horizon. Ocular telehealth is another digital health delivery method for patients, between patients and providers. We saw the quick image on a couple slides ago. We have 2 sites at Porter Primary Care that have retinal cameras, and patients have their diabetic retinopathy screenings done there to eliminate, travel to additional appointments or time for additional appointments. And the images are then uploaded and sent to an ophthalmologist here, who can then grade them, read them, and make any recommendations and potentially follow up if a quick follow-up with an optometrist is needed. Digital health from provider to provider. similar but also different. We have teleconsults, which is essentially a video visit between providers. It can be video, it can be on the phone, but it's the sharing of information between providers to review medical information and make a care decision, sometimes called peer-to-peer as well. And then an e-consult, and an e-consult also uses Epic, our EMR, but it's provider to provider. So a good example of that is a patient presents to their primary care provider with a rash. And instead of referring the patient to a dermatologist, the PCP is able to take an image of the rash and securely send it through Epic to the dermatologist, and the dermatologist can then make recommendations. And we found that this eliminates some unnecessary travel time, referrals, and things like that. So it's a really cool thing that we have. Currently, we're not live with many programs, but that's another on the horizon project that we're working on. So why should you participate? What's in it for you? All of these different delivery methods, they help maintain access to care. We have found that it creates efficiencies for patients, families, and providers, whether that be scheduling or just overall access. We hear that from the majority from our teams and patients. You can connect, message with your care team securely at your convenience. If you have a MyChart account, you can log in 24/7 and send a message. You will not get a message back 24/7, but they will get it during the business hours and they will be able to respond to you. You can manage some of the information on your own. Like I said earlier, you can make modifications to personal information in MyChart, upload an insurance card, a license, things like that, things that you might need to be providing during the registration process. You can get ahead of that and do it on your own. And of course, maintaining social distancing and staying safe. These different modules are virtual, so it keeps you at home, it keeps you away from clinics and others, gives you that distancing. And again, eliminating travel time to and from, which can also help with missing school, work, finding childcare. Today's perfect because it's snowing and everybody's not driving in to come do this tonight. You wouldn't have to travel. You could be home in the comfort of your own home or in a private space. In the video, it showed some of the patient preparedness. So we've put a lot of thought and time into creating a service for our patients who are engaging in video visits for preparedness and providing technical support and a mock video visit with a team who is very well versed in Zoom and can support through the process. So we have how-to guides and videos. They're available online. We have a patient hotline. The phone number is up here. If you have an upcoming visit or you have questions, I'm going to give you their phone number and they're happy to connect with you. Even if you don't have an upcoming visit, you can do a mock Zoom. They can send you an invitation and you can practice. You can download Zoom and just get the feel for it. So when you do have a video visit, you're feeling really comfortable with that. And that's the intent of this patient preparedness service that we've created over the last several months. So that team is available Monday through Friday, 8 to 5. And when they see that patients have a video visit scheduled, they are calling and trying to get ahead of that. I think it's 1 to 2 days before, depending on the service that you have an appointment with, but you could expect a call from them. And I think the last bullet is really important, and it goes back to the satisfaction survey and the comments that I read earlier. We always are looking to improve. We're always looking for feedback. We want to know how things are going. We want to know how people are feeling and how the visits are going. So we love the continuous improvements and feedback and process improvement. So I'm sharing this again because I want it to really hit home. The feedback that we've been getting is really positive. Outstanding experience. I think it's really cool that people are talking about how they're using Zoom socially, but then they're also using it for medical encounters and how that's been a really positive experience. And some comments were that the medical encounter were even more positive than the social encounter over Zoom. So I thought that was really interesting. And it is all about patient engagement. We have patient and family advisors who represent our patients and families, and we bring them in to many projects that we work on. Some are with my team, the telehealth team. Some are with senior leadership. They're at all levels and in all different services and things that we're doing. Could be facilities, could be clinical, to get that input, to get that feedback. So we make sure that what we're focused on and working on aligns with what the patient wants and aligns with that patient-centered care. So we're really proud of this. I love this, and I've seen a lot more of this from my perspective over the last year or so, and I look forward so much to more. The graph down here, one of my colleagues put together for me, and it shows ease of scheduling appointments. So we were trying to compare kind of when we were reacting to COVID and the increase of video visits versus before. So it shows April through August, and the blue is in person and the orange is telehealth. And what's interesting about this graph, I know I'm rambling, but what's interesting about this graph is that patients reported to us that they found that scheduling a telehealth visit was actually easier than an in-person. So I think this is something that we'll track and be happy to report out on. So what's next for us? A lot. We continue to make progress with additional functionality in MyChart. I talked about the insurance piece and I referenced registration. We have a project going right now. It's called e-check-in, and that allows patients to go into MyChart and actually go through the check-in process before an appointment. I think it's about a 7-day window where you could actually do that before, and that mostly replaces the registration process of being on site. We are constantly updating resources and materials that we have internally for not only our patients and families, but for our care teams, so that everything is consistent and up to date. And if we're making any modifications to MyChart or the workflow, it's reflected and everybody has access to that. We're also working on more inpatient services. So we have some specialists who want to do some inpatient consults throughout the network, and that's something that we are working on. That allows patients to stay closer to home. It allows families to stay closer to home. If a patient doesn't need to come here, we can connect them virtually with a care team here if that's what's needed. E-consults, again, is the provider to provider workflow in Epic, the sharing of information. We are hopefully in 2021 going to make a lot more progress with more services where that will be offered. When they are, there will be patient information in the waiting room and probably some nice posters, and we will be able to answer a lot of questions on that. Tele-emergency medicine is also a virtual service where we would connect our emergency room with providers with another emergency room in our community to be able to triage and make some care decisions and maybe transfer decisions around the patient where they present and where it really is the most appropriate for them to be cared for. Teleguidance falls under that. Teleguidance is actually an ultrasound imaging program that we're working on. It's really cool. It allows the patient to be ultrasounded and the provider who's doing that ultrasound be virtually guided by a provider at the medical center. They'll very likely be emergency medicine providers, and they'll actually get their eyes on the patient and the image, and they can work together to get the best images to make a care decision. And then community engagement and initiatives. We're always working with community members about what they're doing, and is there any partnership we can have, and how can we help support. We have a senior center in Burlington who are going to have their participants go there. They already are following the social distancing rules and masking and everything, and they'll go there but connect with the care team at UVM. And so they're getting on-site support by someone in a device. So they're going to be using a desktop, and they'll connect with their care team at UVM. And then we also have a school telehealth program, which I'm really, really excited about, where students can go to their nurse's office and connect with their primary care provider at one of our pediatric offices. And they connect via video using Zoom, very similar workflow to that of a patient and provider if a patient is at home or at work, something like that.
Sarah,
Yeah.
Sorry, before you
Sure.
jump into the next slide, we do have a question in the Q&A box. I'm not sure if you're going to be covering this in an upcoming slide or not, but we have a couple of people who are interested in privacy and security protection under HIPAA in relation to telehealth.
Sure. So the Zoom platform that we use is HIPAA compliant and secure. All of our Zoom meetings have their own, so unique meeting ID and a unique password. So we have all of those security parameters set up. We've had our security teams vet that. We've had senior leadership okay it, and we've worked through all of those.
Thank you, Sarah.
Thanks. What can you do? I think a really great place to start, if you don't already have an email address, is to create an email address, because of course, if you're having a Zoom video visit, then the invitation needs to go somewhere. So set up an email address, start the conversation with your care provider. I know I just covered a lot, and it's not typical language that you hear every day. Talk to your care team. Send them a message through MyChart, ask about a video visit, call them and ask about a video visit or an e-visit. If you have a primary care provider within our network, give them a call and ask. Just start the conversation. You can activate your MyChart account by going, the website is right up here. You can go to UVMMC's website, or you can go to uvmhealth.org/MyChart. And it will give you lots of information on how to sign up, and it will take you through the steps, and then you will be activated. You can also call your provider's office, and they can help you get activated. So you have a couple of ways of doing that. We just showed you a video visits video, but feel free to go back to the website and take a look. There's a lot of information on there. There's some PDF resources, there's some video links. Another thing is to download Zoom. If you're not familiar with it, you can go to the App Store and download Zoom on your phone or Google Play, or you can go actually to zoom.us and you can download it onto your desktop if that's more interesting to you. Play around. You can create an account and you can play around. You can test it out, see what the functionality is, do a video visit with a friend, and just get in there and get comfortable. And then you can call the patient hotline, and here's their phone number again. If you do have a visit scheduled or you just have any technical support questions, they can help you with that. They're really great, very resourceful team, and they love to do this. I think we're back to questions.
Yeah, so we're now going to open it up for any other questions. If anybody has a question that hasn't been answered yet, anything else you were hoping to get out of this presentation, please post it in the Q&A box. And give people just a couple of minutes. Looks like we have one question coming in, so just stay tuned. Okay, so we have a question here. Are telehealth services more expensive than traditional services, and are insurance companies and CMS paying?
That's a really great question. So I don't know how much you know about medical billing and coding, but I will say that we use the same CPT codes, which are the codes that we use for medical billing for an in-person and a video visit. That means that we're billing at the same level of service. And what we've seen, so no, it's not a more expensive service to the patient. And what we've seen is that payments from insurance companies pay almost the same for a video visit as they're paying for in-person services. Because of the state of emergency, there's been a lot of guideline changes this year. I mean, week to week, things are changing, and that's increasing the payer parity. It's increasing the similar payments. So we're actually in a really good place right now with payments, and patient responsibility is not any more for video visits or telehealth encounters as it is for an in-person. I hope that answers that.
Thank you, Sarah. It looks like we have another question that's related to that. And they're asking, my insurance offers televisits. How is this different?
So I'm assuming you mean with a vendor through a different platform. I know that Teladoc and there are others. So the real difference here is that this service, these video visits that I've been talking about, are all provided by our care teams throughout our health network. So these are providers that theoretically you have a relationship with already, and you know. We also use Zoom. I don't know a lot about the third-party vendors that other services are using, but I have heard of insurance companies offering services like that.
Thanks, Sarah. And then we've got one other right now. Someone asks, what services are seeing people in person right now?
Mm-hmm. That's a really good question too. Thank you. So I don't know that I can completely accurately answer that, but I can tell you that from what I know, the majority of our ambulatory services are doing a combination of in-person and video, depending on the indication, depending on the need for a physical examination, things like that. We have found that services like orthopedics even do work over video visits because you can manipulate the camera and you can have someone, move their shoulder and zoom in close and things like that. You'd have to contact your provider's office to know what your options are with them, though.
Thank you, Sarah. Just checking to see if there's anything else coming through. Maybe we'll give folks just another 15 seconds, 30 seconds if they want to pop one more question in there. Looks like we might have a new one. Let me just take a peek. Oh, just a thank you, which is great.
Yeah, thank you.
All right, well, I think that looks like the end of questions right now. That wraps up our presentation this evening. Thank you again for joining. I just wanted to review a few reminders if you weren't with us on in the beginning. So the session is recorded and you will get that recording by email. We will send that to you within a couple of days. Also, with that email, you will get a survey. We really appreciate your feedback and taking the time and completing the survey, especially since we've moved our classes from in-person to virtual. We're really looking for feedback on this new format and platform. So we appreciate your time with that. And again, I'll send you Sarah's slides. It has all the great information for tonight. And thank you again, Sarah, for your time and the excellent information and discussion tonight. And on behalf of the UVM Health Network, I'd like to thank you for joining us this evening, and we hope that you'll attend another class, and we hope to see you again soon. Hope you have a great evening. Thank you.
Thank you.